Today we're going to go over one of the most common things seen by a chiropractor, and that's sciatica. S for sciatica. A lot of people come into the office with sciatica or explain that they have sciatic-like symptoms. So first off, we have to determine if it is truly sciatica or if it's something else. Typically with sciatica, we'll have pain, numbness, tingling, sometimes weakness that will start into the low back and radiate all the way down into the leg and sometimes even the foot. If it doesn't go past the knee, oftentimes it can be something else. A lot of sciatic pain is classified by traveling past the knee into the leg as well as into the foot. So we're going to look at some things today that cause sciatica. And as you can see on the slide, that can be anything from muscles, discs, joints, and nerves. So first, let's take a look at the actual anatomy of the sciatic nerve and what it is. So these are the nerve roots coming out of the lumbar spine as well as the sacrum. So if we look over here on the right, you can see here's the big sciatic nerve, which is actually the biggest nerve in your body. One thing that a lot of people don't know is the sciatic nerve is actually made up of two separate nerves. So you can see this green one here and this yellow one here. Together, they are the sciatic nerve. So we have the yellow one, which is the common peroneal bundle, or the common fibular bundle, as well as the green one, which is the tibial bundle. So the tibial nerve and the common fibular nerve, or the common peroneal nerve. L4, L5, S1, S2, and S3, all those nerve roots together make up the sciatic nerve. So based on which level of the nerve is irritated, symptoms will present in different areas of the body. So if we go over here to this picture, this big sciatic nerve here comes out of the pelvic region, goes down into the back of the leg, and then right about the knee, it splits into the two nerves that it carries from up above, which is that common fibular or common peroneal nerve. That one comes out here a little bit more to the lateral aspect of the leg. And then the tibial nerve, that one goes a little bit deeper into the leg, into the calf muscle and some other areas of the leg and foot. So based on where the irritation is over here at the nerve root level, it will translate down into different levels of the leg as well as into the foot. So symptoms can be a little bit different based on where the sciatic symptoms are coming from. So we look at different causes of pain. First, we're going to look at the muscular type cause. So this piriformis muscle is a muscle that attaches here to the tailbone and goes all the way out to the outside of the hip. The sciatic nerve, in most people, travels underneath that muscle. There are some cases where that sciatic nerve will actually pierce through that muscle, and people that have that anomaly or that anatomical variation will have more sciatic-like symptoms, because if this muscle is impinging on that nerve, because that nerve is piercing through that muscle, if you can imagine when that muscle contracts, it's pressing down on that nerve. You can see in this picture here, this muscle, the piriformis muscle, can also press down on that sciatic nerve and press against the bone here. So if there's a spasm or too much tightness within this piriformis muscle, it'll press down on this nerve and also cause sciatic-like symptoms down into the leg. So this muscle can be one cause of sciatic pain. We also can look at this picture here, which is the disc of the lumbar spine. The disc, if we have a bulge or a herniation, as you can see, if it pushes out this way, here we have the spinal cord. We have the spinal nerve roots coming out towards the side. So that L4, L5, S1, S2, S3 nerve roots, they're going to look something like this. If the disc is bulging out and either there's chemical irritation or even pressure from the disc bulge onto the nerve, you're going to have those sciatic-like symptoms down into the leg as well. Here's a side view of what that would look like. So we have the lumbar spine right through here. We have the discs in between the vertebra. And then if we have that bulging outwards, it can press or irritate from a chemical irritation or a mechanical irritation, either the spinal cord itself or the nerve root. So depending on where that bulge is, if it's a central bulge, it's going to be more towards the spinal cord. If it's more of a lateral bulge, it's going to be more so towards the nerve root itself. We can look at this picture over here as well. There's a lot of different things happening over here. Up here we have the normal disc with the normal vertebral bodies. If we go down a level, we can see what a degenerative disc looks like. If this disc degenerates, the height of it decreases. So with the height of it decreasing, this space right here, which is the vertebral foramen, where the nerve roots come out, this space is going to be decreased. So there's not as much room in the vertebral foramen for that nerve root to traverse through and travel. So with less space, can also cause for what we call foraminal impingement or foraminal canal stenosis, and that can be a cause with the degenerative disc. With the bulging disc, you can see it bulges out backwards, kind of how we already talked, whether it's a medial bulge or a lateral bulge, it's going to also close down that foraminal canal space. Same thing with a herniated disc, which is a lot more severe than a bulging disc. It's really going to close down that space and potentially impinge on those nerve roots. We can also have a thinning disc, which is similar to a degenerative disc. The disc height is less compared to what the normal disc would look like. So this space is also going to be less over here in the foraminal canal. The degenerative disc can lead to also osteophyte formation. So osteophytes are pretty much arthritis and degeneration of the joints as well as the vertebral bodies themselves. So as you can see, this is jagged. There's some osteophytes protruding backwards into the foraminal canal. So that also closes down the canal. So there's less room within the foramen for that nerve root to go through. This compared to up here where this one's nice and open, you can see there's less space. So that less space can cause irritation as well as pressure that will cause sciatic-like symptoms. Speaking specifically on stenosis, stenosis is something that can cause sciatica. Stenosis simply means that there's closing down of a space or less space than what you normally have. So we can have spinal canal stenosis. So right here is your spinal canal where the spinal cord goes through. You can see this is the disc here, and this is the back of the vertebral, the vertebra in the vertebral body. So here's the normal one. This is nice and open. That's where the spinal cord can go through normally. If there's any type of arthritis, ligament thickening, disc bulging that is closing down on this spinal canal, that would be spinal canal stenosis, and that causes or can cause some sciatic symptoms. If we look here over on the other side, we can have what we call foraminal canal stenosis, and that is where the nerve roots are coming out. So you can see here's the spinal cord, the nerve roots come together and come out this little space, which is where the spinal nerve roots come out and form into other nerves. So if there is something closing down on the spinal foramina, then you're going to have foraminal stenosis. That foramina can be closed down based on arthritis. So if this joint right here becomes arthritic, it can create those osteophytes that I mentioned before. Also, if there's a lateral disc bulge through here, that disc bulge can cause foraminal stenosis as well. And those are probably the two main things that will be causing the foraminal stenosis that closes down this space. And you can see there's less space here compared to here. These pictures show quite a bit of different things. This is going to show more of stenosis, more spinal canal stenosis due to a ligament that is thickening or a ligament that is calcifying or ossifying. So there's hardening of that ligament and thickening of that ligament that closes down the space. So right through here in the middle, we can see we have the spinal cord. We have the vertebral bodies right through here. This picture specifically is actually the cervical spine, but the same thing happens in the lumbar spine. We can see these light bluish colored things are the discs. So in some of these cases, we have a disc bulge or a disc herniation that is pressing back and closing up the space of the spinal canal. Behind the vertebral bodies and behind the discs, we have a ligament. And this ligament here is the posterior longitudinal ligament. This ligament goes all the way down into the lumbar spine, and it helps with supporting of the spine, just like all other ligaments in the body do, supporting the joints, and they attach from bone to bone to support those joints. So if there is degeneration within the disc itself, or if there's degeneration within the vertebral body, so if this becomes smaller or this becomes smaller, then it's going to buckle this ligament. And when this ligament buckles, as you can see here, it presses backwards and closes down the spinal canal. So there's less room for the spinal cord to go through, and we call that vertebral canal stenosis. We also have ligaments towards the posterior, the back of the spine, where the spinous processes are. So in between each spinous process, you're going to have this ligament here, which is called the ligamentum flavum. So this ligament can do the same thing as this ligament, where if there's decreased space between those bones, it can buckle. And you can see that buckling right through here. Over time, those ligaments can also ossify, so they can become hardened. And so there's less elasticity within those ligaments. And as you can see, that ossification and hardening also cause a little bit of a bulge back here that closes down the space where the spinal cord can go through. Also, with the bulging and the buckling, you can also have thickening. So if this ligament thickens, it's also going to close down the spinal canal, so there's going to be less space. So a couple different things that can happen to the ligaments of the spinal canal that can cause stenosis, less room for that spinal cord to go through. We can look at these cross sections here. Here's the ligamentum flavum back here. Here's the spinal canal. So you can see this is nice and open. If we have thickening of that ligamentum flavum in the back, that spinal canal is a lot smaller, so the spinal cord doesn't have as much room. You can also see in this picture, you have a bulging disc. So this one, you have thickening of the ligament as well as bulging of the disc. Those two together are really going to close down the spinal canal, and you can have those sciatic-like symptoms down into the leg. Also, one other thing to note is over here we have one of the facet joints. So the facet joints are just a joint towards the back of the spine. They kind of help with limiting certain motions with flexion, extension, and rotation. If there is degeneration within these facet joints, then you can see that there's some jagged edges, as well as there's bone hypertrophy. So there's more bone within the joint itself, which causes less space around the spinal foramen. So here would be considered a normal one. Here's that joint, looks nice and healthy. If we go down to these two levels, you can see how it's degenerative, as well as some of that degeneration causes some osteophytes to form and take up some of the space of that spinal foramen. So less space for that nerve root to come through, which will cause irritation to that nerve root, and then sciatic-like symptoms.